Hello, my name is Mary Smith and I am a nurse practitioner student with the University of Phoenix. If you have a few minutes, I would like to ask you a couple of questions regarding your thoughts on the roles that the nurse practitioner plays.
Hello Mary, my name is John and I am a family nurse practitioner. I would love to answer some questions for you.
Great! I am looking to get your views on the different roles the nurse practitioner plays with regards to educator, expert, researcher, consultant, leader, and change agent. These are all very unique roles to the practice of a nurse practitioner.
Starting with my role as an educator, I am responsible for educating everybody from my patients, my staff, and myself. My patients rely upon me to educate them to their disease process and how to effectively remain compliant with their treatment plan. My staff relies upon me to educate them to the latest clinical practices that allow them to provide sound clinical practice. Lastly, I am responsible for educating myself and staying current with clinical guidelines and best practice models. I believe that the role of expert and leader are nearly synonymous. My education and experience make me an expert in the field. This designation affords me the ability to be seen as a leader. The reason for saying this is the simple fact that everybody looks up to me to lead them in the right direction. It makes for a significant amount of stress at times.
So far it seems as if there are a significant amount of demands placed upon the nurse practitioner.
Yes, there are a significant amount of demands placed upon us working within the field of advanced practice. Now to discuss my role as a researcher. We are responsible to collect and analyze data in order to help shape the best practices for our patients. This is an important task that helps the entire field stay current with treatment regimes. As a consultant, we can be viewed in two different ways, either internal or external consultants. As I am the practice owner, I am not an effective internal consultant as they are normally viewed as having less administrative authority. Externally, I have helped others establish their practices and I have helped patients with long-term management of their health issues.
Wow! You are getting me excited for my new role. I can hardly wait to finish school.
It surely is a significant amount of responsibility. Now for my role as a change agent, it can be very complex. Essentially, the role requires me to be proactive at changing things and not become satisfied with the norm. Sometimes people have a difficult time accepting and adapting to change, and that is where I come in. I attempt to make transitions easier for everybody involved. This role is enhanced by the other roles that I fill. Good leadership abilities are needed to be effective in fostering change both internally and externally.
It looks like I'm going to have some pretty big shoes to fill once I complete my program. For my last question, what role do you think is the most important role for an advanced practice nurse and why do you feel that way?
I believe all of the roles are equally important. The most important thing to remember is that the patient is why we are here doing what we do. In order to be effective at providing them the best care, we must be effective in each role that we have covered today.
Thank you for taking the time to speak with me today. I hope to collaborate with you in the near future.
It has been my pleasure. Good luck with the remainder of your program.